Welcome back. We're talking about the link between poverty and bad health this morning. There's a new study showing the connection runs deep, and Emanuel Alcala is one of the study's authors. In fact, the lead author. He joins us this morning. Thanks for being here. We appreciate it.
Thank you for having me.
All right, so your background, you actually spend most of your time, you're a PhD student at UC Merced, but you're also working at Fresno State at the same time on these sorts of issues.
Right, at the Central Valley Health Policy Institute.
All right, and so you're working on this. You're looking at, what I found interesting is that you're looking at this because people, a lot of times, they know that the people who are poorer tend to have worse health outcomes.
Right.
But you go deeper. You say it's not just if you're poor, it's if your neighborhood's poor,
right,
and that affects things as well on a separate scale.
Right. Right. So what we've been able to do with this study is kind of separate, we know pretty well there are person level risk factors for asthma specifically in this study. So we're able to separate those individual level effects from the neighborhood level effects. So we're able to say that the level of poverty in your community has independent effects and effects beyond whatever risk factors you may have as an individual.
That's interesting. And looking just at asthma, why did you decide just to look at asthma when figuring this out?
Well, we know asthma is a big problem here in the valley, right?
It is, and this past week was a good indicator for that with our bad air.
Exactly, right. And so this study here is kind of the first piece looking at kind of the social characteristics of your community in terms of asthma morbidity, and some follow-up studies would be to look at potentially how does air pollution and your social circumstances kind of come together to produce poor health.
All right, so I'm interested exactly how this works. So say you're somebody who is individually poor, but maybe living in a zip code or a neighborhood that is more affluent. Does that person, because they are individually poor, but they live amongst more affluent people, are they going to tend to be better off than somebody who's poor and amongst poor people?
That's pretty accurate. That's exactly what we find.
Did that surprise you at all?
Yes, in the sense that this has kind of never been looked at before. We know that children who are publicly insured are at higher risk than children who are privately insured, but we haven't been able to measure how that difference changes across geographies and across neighborhoods. So what we find is that relationship changes across the level of poverty in your neighborhood, so that in the poorest neighborhoods, that difference is largest.
Okay, so you're looking at Medi-Cal rates and everything in this study.
Correct, correct. So, usually kids who are on Medi-Cal are about 3 times at higher risk than kids who are privately insured, and we find that difference is highest in the poorest communities. You could even say that difference is not as big, right, in the most affluent communities, kind of going back to one of the first things that you said. Kids who are on Medi-Cal living in more affluent communities, there's something perhaps socially or institutionally there to protect against asthma morbidity.
All right, so when you hear that, because I think that, I'm like, wow, that's interesting, and I wonder where that comes from. So you mentioned follow-up studies. Have you already identified other things that you want to look in specifically? Like, okay, this was interesting, let's dive deeper into that.
Exactly. Because we found these neighborhood effects, what we've already done is we've identified 60 different census tracts in the city of Fresno, and we've measured these for things like social disorders and institutional disorder. So things like, kind of gang activity, alcohol bottles, cigarette butts, things that might cause some kind of social stress on a child. And we want to see if that impacts asthma morbidity, if that explains our finding about concentrated poverty at the neighborhood level impacting asthma.
Where does the funding come for a study like this?
So this is funded by the NIEHS and the EPA, so that's National Institutes of Environmental Health Sciences.
Okay.
And so Fresno State is part of the CHAPS group, which is the Children's Health and Air Pollution Study, and which is a collaboration between several UCs, including Berkeley, Stanford, Fresno State, and a few others.
So is this just done in the Valley? The study, or did you go to other states? Yeah. Did you go to other areas?
So the CHAPS group is looking specifically into Fresno.
Sure.
The study that that you've come across is looking at the entire San Joaquin Valley.
Okay. So
that's kind of the story of the San Joaquin Valley there in terms of asthma morbidity.
How long until we see more studies on this?
The sooner the better, right?
Yeah.
For the valley.
Okay. Was there one particular area? I mean, San Joaquin Valley, there's a lot of poverty up and down that valley. There's a lot of bad air up and down that valley. Is there certain areas, though, within that you saw the worst health effects, outcomes?
You know, so the study kind of suggests that the most rural areas, you know, those families living furthest away who are
Does a lack of doctors, you know, access to a doctor and stuff like that?
you know,
does that
interesting.
impact?
So we measured for, you know, primary care shortage areas, physician to person ratios, and number of healthcare facilities in your community. And the strongest indicator was concentrated poverty. So, I mean, that not to say that those other things don't affect asthma. However, there's something about whatever poverty's picking up across neighborhoods that explains this asthma morbidity.
Well, it's a really interesting study. I'm going to include a link on our website that everybody can check out, yourcentralvalley.com. Emanuel Alcala, best of luck on your PhD.
Thank you so much. Appreciate
I
it.
know you're a busy guy, and we appreciate you taking the time to talk to us about this today.
No, thank you.